And Peggy has a question. She's on our
Hmm.
YouTube and she wants to know about femoral endarterectomies and whether they can fail.
Yes. The answer is yes. So an endarterectomy is basically filleting the artery open through surgical means, scooping out the cholesterol, sewing it back in. So it's a very invasive procedure. I'm not a surgeon. I don't cut. I'm a plumber. I do everything through IVs. But we have vascular surgeons who are dedicated to circulatory problems. And endarterectomy is actually a great therapy. So basically in the groin here, which is the common femoral artery, which is the entrance to the leg. Those arteries can become narrowed, blocked up, or highly calcified rocks in there. And so usually when it's a big rock in there, it's hard to kind of go in there and unblock those arteries from the inside with the plumbing that I do. So a lot of these patients, I do refer to these vascular surgeons. Basically, under anesthesia, they'll open up that area, they'll clamp the artery, they'll open it up, they'll scoop out the big rocks of the cholesterol blockage in there, and they'll sew it right back up. It is an excellent therapy, but yes, they can fail. And so, progression of the disease, once you have blockages from PAD, you're always at risk from having further blockages. So that might be a reason it fails. And not taking your medications, not walking, not losing the weight, and controlling these risk factors. Those are also reasons that these things can fail. It's very rare that you have, a surgeon who does a botched job or something like this. This is what they do. That's their specialty. So even that's lesser on the reasons why. So probably more to do with the degree of disease somewhere else, or the patient just not taking care of themselves.
Yeah, and can they go back in and do a
Mhm.
redo on the end art, or is that something that you as a plumber can go back in and at least attempt in those areas that have had a previous endarterectomy? Can you go in a minimally invasive way with wires and catheters and balloons and try to do a little roto rooting there?
So the quick answer is yes, but there's a lot of kind of caveats to that. So it's
Hmm.
when a surgeon touches someone or does something to, you have to be very careful to go ahead and intervene from an endovascular, from an inside perspective with balloons and stents.
Hmm.
That area has been manipulated. Your body has responded with some type of inflammatory response or some type of response to heal the area, not only from the outside but also from the inside. And so timing of when the surgery is a big one. And one of the other things we run into as specialists is we don't have a lot of times readily the reports from other specialists available, or even able to get them. We know that there was a procedure performed. We don't know the details behind it. If
Right.
there was any complications, how long it was, if the patient tolerated the procedure well or not. So I'm always weary about going in and trying to fix surgical issues. Not that I haven't. I've fixed bypasses before. I've opened up arteries across bypasses before. I've fixed
Yep.
endarterectomies before. But it's all about getting to the right person, the right specialist to kind of guide you down that path. But the quick answer is yes.
Yeah, I mean, I'm sure you've bypassed bypasses that other doctors have not been able to, with blockages that others have not been able to get through or never even attempted. So we always say that if your bypass fails or an dart fails, it's always really good to get multiple opinions. And, as Marie is asking,
Absolutely.
how often do you have to have a redo on bypasses and stents and things like that? And it does depend on the person. And it is always good to get multiple opinions to make sure that you
Hmm.
understand all available options out there, because one doctor may have a certain skill set and another one might have an entirely different skill set. So get multiple
Absolutely.
opinions to understand all available options.